Good afternoon, everybody. This is Bob Hilke with Premiere Alignment Consulting. And the purpose of this meeting, it's a weekly meeting on Fridays, just to give our strategic partners a chance to come in and ask any questions that they have. So I'll just open up for any questions. If anyone has any questions, we'll take those now. And if not, I'll just take a couple minutes to share something. I'm going to screen share here. And so this is a little flyer that I put together recently, and I'll make it available if any of our strategic partners would like to have a flyer like this with their picture, their name on it, instead of my picture and my name. I'll be glad to help with that. But let me just talk through it briefly because I think it gets to the essence of our offering here, why we can help companies. First of all, Premiere Alignment is the consulting firm. The parent company is Orion. Premiere Alignment is the consulting firm, and our model of healthcare that we help companies implement is called aspirational healthcare. And what we do is we, as consultants, align the healthcare system to work for CEOs. And we are an independent consultant, nonpartisan consultant. We're not associated or affiliated in any way with any insurance company or with any particular broker or with any, we're not a broker, we're not insurance agents. We just consult with the CEOs and their leadership team to help them align healthcare to work for their company. And it's not that we replace brokers necessarily, because we need brokers, but we're not one, so we have to use either the broker that the company's already using, or if necessary, we can bring in a broker that's familiar with our system and have them help implement that as well. So we have those options. But we implement the only healthcare model in the world that's received the Presidential Malcolm Baldrige Award for quality, not once, but twice. Yet hardly anyone has heard of it. So it's a great opportunity for us to share this incredible healthcare model and help companies leverage healthcare to accomplish their business objectives. When we implement our model of healthcare, it helps companies cut the healthcare costs for their healthcare benefit program by 30 to 60%. That's our actual results. Typically, it's around half. If a company is spending $9,000 or more in healthcare benefits, they should talk with us because we'll help cut the cost down to $6,000 or $7,000. The average in America today is close to $14,000 per employee per year. So cutting that down from 14,000 down to 6 or 7,000 is a huge cost savings. And because healthcare is the second largest corporate expense in America today, oftentimes by cutting that second largest corporate expense in half can double the company's profit margin. So we're talking a significant financial impact to help the company to free them up from this huge cost and in many cases double their profit margin. Now, a lot of times when we are talking about healthcare, people get in their mind that, well, we don't want to change anything right now because it's not open enrollment. Well, with our solution, it's a bolt-on. We can add it any time during the year. It doesn't have to be timed with renewals. And it's not necessarily going to replace what you're doing. We're adding new choices. And so as we add new choices, the employees are going to like the choices we bring because it's going to result in them having less expense for their healthcare. In fact, they should no longer need to contribute to the cost of premiums. And when they go to visit their doctor, they should no longer have any deductibles or copays. So how does that sound? My wife gets health insurance through her employer. It's a $10,000 deductible. It's a $15,000 out-of-pocket max. That's in addition to paying monthly toward the premiums. So think about all of that going to the side, not needing to spend all that money, and instead not paying towards premiums, and instead not having deductibles or copays. So if you're an employee, you're going to love this healthcare model. And if you're an employer, you're going to be spending a lot less than you are today. And another reason employers love this model is because the employees like it so much that when we've surveyed them after implementing this model, 98% say they wouldn't leave their current employer because they like the healthcare benefits so much. So if you're a CEO trying to figure out how to attract and retain top talent, this is a really excellent tool to help you with that. And turnover is very expensive because these days it can be up to 140% or more of an annual salary. And when you're talking about turnover at management levels where the salaries are big and where the training may be more complicated and take longer, it could be even more expensive, but it's huge cost to any company to have turnover. This is a great way to attract top talent and to retain them as well. And another thing that our solution does is it mitigates the risk of fiduciary liability that companies have for new legislation that was implemented in 2023. It's kind of like back in the days where 401ks became popular. And the reason for that is because the government implemented some legislation that placed fiduciary responsibility on companies that manage retirement funds of their employees. Well, of course, the companies didn't want to have that fiduciary liability, so they said, we'll give all the responsibility for managing retirement funds over to the employees. And that solved that little problem. Well, the same thing is going to happen in healthcare because in 2021, a law was implemented that was written that was implemented in 2023. And already there are class action lawsuits because employees can sue their employers if they feel the employers are not managing the cost or the benefits of their health care the way that they would like. So this is going to be a huge issue for companies, and it's probably not on the radar of all the CEOs that you know. So as a strategic partner, I think you may begin to see that there's a lot of opportunity here for you to bring good news to the CEOs and business owners and other business leaders that you have in your network. Let them know that there's this incredible model of healthcare they probably haven't heard of before. It's going to save them a lot of money. It's going to reduce their legal liability for this new legislation, and their employees are going to love it, so it'll help attract and retain top talent. And guess what? We have a money-back guarantee on our consulting. We promise companies they will save money, and we offer money back when we fail to help them save the money that we promise they will. So it's an incredible win-win all the way around. And as a strategic partner, it seems to me it should be a pretty easy conversation to have with any business you've supported in the past or currently to leverage the relationship you've already built with them and say, hey, I know this guy that's helping save a lot of money for companies on their healthcare, and the employees love it. I'd love to make an introduction. And I'd love to hear from you if you have anyone that you would like to introduce. We'll figure out the best way to make that happen. All right, thank you. I'm just going to open it again. If there's anyone that's joined the call that has any question, now is a great time for that. So what I'm going to do is wrap up the meeting and thank those that attended. Thank you and have a fantastic week. And this meeting occurs every Friday at 2 p.m. Mountain Time. Have a great week.